Novel coronavirus or COVID-19. Is it airborne? Can I spread it if I'm asymptomatic? Studies show that a number of supposed myths from the novel coronavirus may actually be fact. Researchers have found that the virus can live in air particles, can be spread by people who are asymptomatic, and is largely absent in extremely cold and very hot climate conditions. A federally funded study recently published in the New England Journal of Medicine found that the novel coronavirus can survive in air particles for hours and on surfaces for days. The researchers behind the study hail from Princeton University, UCLA, the National Institutes of Health, and the Centers for Disease Control and Prevention. They determined that COVID-19 could survive for up to a whole day on cardboard, 3 days on plastic and stainless steel, 4 hours on copper, and 3 hours in aerosol. Lead author Dr. Nilce van Dormalen from the National Institutes of Health wrote that people may acquire the virus through the air and after touching contaminated objects. The World Health Organization is reportedly considering that medical staff take airborne precautions. A study published in the journal Eurosurveillance also found that of the 3,711 passengers and crew members aboard the Diamond Princess cruise ship, 17.9% of the infected were asymptomatic. The team behind the study consisted of researchers from Oxford University, Kyoto University, and Georgia State University. After a former passenger tested positive for COVID-19, the entire ship was placed under quarantine. A similar study by researchers from Hokkaido University about infected Japanese nationals is set to be published in the International Journal of Infectious Diseases. The researchers found that of the 565 Japanese nationals evacuated from Wuhan, 30.8% who tested positive for COVID-19 were asymptomatic. These two studies only prove that people may not be aware that they are potentially spreading the novel coronavirus to others. As for the weather's effect on the virus, studies have pointed to a correlation between warm weather and coronavirus transmission rate. One study published on medical preprint server MedRxiv found that communities in polar and tropical climates are unlikely to experience local transmission. Scientists say that transmission may not be as efficient in humid environments, but the world should probably only expect modest declines in the virus contagiousness. Airborne diseases are those that can be caught simply through breathing. Nasal and throat secretions of sick people can make their way into the air and land on surfaces and people nearby. You can catch a disease after breathing in airborne pathogenic organisms or touching your eyes, nose, or mouth after touching germ-ridden surfaces. Airborne diseases include the common cold, influenza, chickenpox, mumps, whooping cough, tuberculosis, and diphtheria. Many of these diseases, like influenza, spread so fast because they're contagious even before one notices their symptoms. Airborne diseases are normally treated with fluids and rest, considering those like the chickenpox have no specific treatment. The flu, on the other hand, can usually be relieved with the use of antiviral drugs. Airborne diseases are most common in schools, nursing homes, and crowded areas, occurring all over the world. However, they are less present in places where affordable vaccines are widely available.